The doctor is in, and today's topic, the signs of cancer that some women may be ignoring. Routine tests are important, but you can't always rely on tests alone to protect yourself from cancer. It is just as important to listen to your body. So Dr. Scott Ackerman, one of the First Coast's leading oncologists, is here to talk about some cancer symptoms that should never go ignored. And some of these, I'm thinking, oh, you know what, I've kind of suffered from, should I do something about it? But let's go down these one by one, and then we're going to have you expound upon it. So first sign you should not ignore: wheezing, shortness of breath, chronic cough, that sort of thing.
Yes, thank you, Casey. There's lots of benign reasons for wheezing or shortness of breath or a chronic cough. It could be asthma, especially this time of year. There's a lot of pollen. It seems like this past week here in Jacksonville, and that pollen will give you some just allergies from that. So asthma, bronchitis are common benign reasons for cough and shortness of breath. But cough and shortness of breath can also be an early sign of lung cancer. So you don't want to completely ignore it. If it goes away, that's okay. But if you have a cough, shortness of breath, and maybe some chest pain or perhaps some coughing up of blood now and then, that's a real serious thing, and you should see a physician because it could be an early sign of lung cancer.
What about lymph nodes? The thing we can feel in our neck and, and under the armpit. What if those get swollen? I mean, and I have known people who have had like a swollen lymph node, and then they freak out. They get, oh my goodness, what does this mean? When should we be concerned?
Well, you don't want to overreact because we all get swollen lymph nodes in our neck or under our arms or our groins now and then, and that's because of an infection or something. The lymph system is like the blood system. The blood system has arteries that bring blood to the body and the veins that bring blood back, but the lymph system brings back this lymph fluid, which is the fluid that filters out bacteria and waste from the body. So if you get cut in your leg and you get a little bit of infection there, the body fights that infection, gets rid of the bad germs, and those germs and the infection, the bacteria, get incorporated into the lymph system, and you may get an enlarged lymph node. That'll eventually go away as you get over the infection. But also cancers spread through the body, through the lymph system as well. And when these cancer cells break off from where they began, they can accumulate in the lymph nodes. They get filtered in the lymph nodes just the way bacteria does, and there could be an enlarging lymph node that could be a sign of cancer. So for instance, I frequently see women who have a lymph node in their armpit, and they don't know they have cancer, and that lymph node was getting larger and larger. And just last week I saw a woman like that was sent over to see me, and we obtained a mammogram, and sure enough the mammogram showed a very small tumor in the breast. So breast cancer frequently goes or can go to the lymph nodes in the armpit. If you have a lymph node in the neck, and I see a lot of patients like this where they have one lymph node that grows in the neck, that is frequently the first sign that someone has a cancer of the throat or the tongue or the tonsil. It's just an enlarged lymph node. They never smoked, they don't have any problem swallowing or with their speech, but a lymph node grows in the neck. And if there's multiple lymph nodes, that could be a sign of lymphoma. So a lump that grows and doesn't go away and continues to grow, a lymph node in the groin or the armpit or the neck, you should see a physician.
And I've heard give it like 2 weeks, give it 3 weeks, give it a month sometimes for a lymph node to go down. If it goes down, should you still go in and see a doctor?
No, if it goes down, you're probably okay. But you should give it I don't know, a month, but a week or so, and then see your physician. Cancers, they grow rapidly, but not that rapidly, and so you're not going to lose much if you wait a week or so before you see a physician.
Okay.
There are some cancers where the lymph nodes do wax and wane. They're typically in elderly people, and they're usually very indolent cancers, something we call chronic lymphocytic lymphoma, where the lymph nodes will wax and wane. But if a lymph node comes and goes away, that's fine. But if it comes and goes away, it comes back again away, then maybe you should see somebody.
You should do something. Okay. Also, a lot of ladies, they like to lose weight, and sometimes for no reason. You just want to lose weight because. And if you're losing weight, and let's say you're not even really trying to lose weight, that's really something that you should be paying attention to too.
Right. Everyone likes to lose weight, men and women.
Yeah.
And we don't like to work at it. We love to be able to lose weight. But if you have unexplained weight loss, where there's no change in your diet or exercise, that's a cause for concern. If you're going to lose weight, you have to do something. You have to either eat less or exercise more. So it's all just about calories, whether the food goes in or whether you're burning calories. But if you're not eating less or exercising more and you've had weight loss, that should be a concerning thing. Weight loss is frequently associated with lung cancer. It's frequently associated with colon cancer and digestive cancers. If cancer spreads to other parts of the body, like the liver, you can have a diminished appetite because of that. The liver helps the body get rid of waste and things like that. So any unexplained weight loss, see your physician.
And then last but not least, for women who are out there watching right now, and I know that you mentioned the swollen lymph node that's under the armpit that could be associated with the breast. Obviously have that checked out if it's, if it's swollen for a prolonged period of time. What else? What other signs that we might have breast cancer?
So, breast cancer is the most common cancer in women. Luckily, with mammography and increased public awareness about breast self-examination, we're diagnosing breast cancer earlier than we ever have, and women are being cured with breast cancer so much more than ever before, and it's no longer the death sentence it used to be. It's a very curable disease, and most women find the breast cancer by feeling a lump in their breast. But sometimes breast cancer does not present as a lump, but changes in the skin instead. Maybe redness of the skin, dimpling of the skin, hot sort of skin. That could be what we call inflammatory breast cancer, where it's diffuse involvement of the skin and subcutaneous tissue with the breast cancer. So not just a lump, but just a change in the breast. Remember, get your screenings for breast cancer, get your screenings for all cancers, because the earlier we diagnose cancer, the easier it is to treat, and the better chance we have to cure cancers.
All right. Well, Dr. Ackerman, thank you so much for being here again, and thank you for sponsoring the segment. And Dr. Ackerman, he's with us every Friday. Next week, we're going to be talking about a specific type of cancer, colon cancer. And for questions regarding today's topic or any other health questions that you might have, visit firstcoastoncology.com and confidentially submit your questions to Ask the Doctor.